When I think about IKS, I think about a company that's really built around the complex problem of delivering care in a consistent, efficient manner and doing it in a way that the physician finds meaningful, the patient finds compassionate, and the health system succeeds financially so that they can thrive.
You know, I went into medicine because of the patient-doctor relationship. And what's happened over the past 5-10 years is that the computer technology, the information, the need to interact with systems has gotten in the way of that.
The physician is constantly addressing the computer, entering things in the computer, and distracted from the one-on-one contact with the patient.
Our staff are spending tremendous hours taking medication renewal requests from patients, from pharmacies, through faxes and so on.
Statistics tell us that there are 250,000 lives lost every year in the country due to medical errors.
Over 50% of physicians in the U.S. are burnt out. There's just too many, the expectations are too great, and they can't focus on patient care like they've always wanted to and like they were trained to do.
Well, how can we bridge this issue? How can we bring back that personal relationship between the patient and the physician and nurse so that the challenges associated with technology can be pushed out of the way?
Where IKS has really helped us is they've helped to manage some of that information flow. They help to scan in the documents. They help to bring that information and data directly to the physician in an efficient, timely way so that the physician can digest that information quickly right in front of the patient.
By centralizing the work and delegating it to IKS, we've managed to reduce the work of our nurses and MAs 64% in regard to medication renewals.
It helps with billing, it helps with coding, it helps with scribes.
Our use of the virtual scribe has completely changed the life of a number of our physicians. We have one physician who reduced his clinical hours and said he thought he was going to need to retire because he just couldn't handle all the work that was involved. Now, using a scribe, he says he feels rejuvenated and actually has added clinical hours back in and said he's ready to keep working for years.
What IKS does is it says, don't worry, just concentrate on the patient and we will take care of all your documentation needs, so that magically the physician comes back the next day and guess what? All the screens are populated with exactly the right information, so he continues going back to work, enjoying his work, rather than have to worry about all the stuff he's going to have to fill in on the screen day after day.
When I can focus on my patient, one more thing happens. The patient trusts me. And when the patient trusts me, they are much more likely to engage in their healthcare and they're much more likely to have a better outcome. That is so meaningful to me as a physician. That's why I decided to go into medicine in the first place.
We've gone from 4 employees to 4,500 employees. We've gone from helping one provider to 14,000 providers and millions of patients.
It is almost like magic for these physicians. I don't think they'll ever want to go back to the way it was before IKS.
IKS gives doctors time to care.
Simple solutions for complex problems.
IKS Health.
Healthcare as it should be.